We're going to turn now to hear a state perspective on this topic, and we're so pleased to have Jessica Altman, who was recently appointed Acting Insurance Commissioner of Pennsylvania on August 19th of 2017. Prior to this, she served as Chief of Staff for the Pennsylvania Insurance Department alongside former Insurance Commissioner Teresa Miller beginning in June 2015. She also has experience at the federal level, having worked at the HHS's Center for Consumer Information and Insurance Oversight. And we're pleased she's with us today to share a state insurance commissioner's perspective on stabilizing this market. Commissioner Altman?
Thank you so much, Catherine. And really, as we always say in health policy, once you know one state's perspective, you know one state's perspective. So I will call this a Pennsylvania insurance commissioner's perspective on the individual market. I'm not sure I have the ability to move slides forward, but what I'm hoping to cover today is a little bit about what we are already doing at the state level to try to contribute to stabilization and how we dealt with those issues for the 2018 plan year, and then a little bit about how we as states, or at least as Pennsylvania, have thought about some of the proposals and evaluated proposals for stabilization and what we've made priorities that we have advocated for and will continue to advocate for as discussions move forward. So in terms of 2018, Pennsylvania was in a unique position. We did approve significant rate increases for 2017 because, as Kurt indicated, we did believe that our market was significantly underpriced and we needed to make an adjustment to get to appropriate prices. And we believe that we did do that. And I think if you looked at our initial rate filing that we received at the beginning of the summer, we had done that, and we would have seen a 8% statewide average increase, which between medical trend and the new health insurance premium tax was about where we would have expected to be. Of course, given the uncertainty and the non-funding of cost-sharing reductions, we ended up approving a 30% increase. I also think throughout that process, as many of you know, states are where the rubber really meets the road on these issues. State regulators are the ones negotiating rates with insurers, talking about products, and really I view it as my responsibility to make sure that Pennsylvania in 67 counties, and all of our counties here in Pennsylvania, continue to have access to individual market coverage. And while we did not struggle with a Bear County here in Pennsylvania, it was certainly more of a challenge to ensure that we avoided that issue this year than it has in past years. And so we did end up, similar to other states, accepting a second filing that would account for non-payment of cost-sharing reductions, and also, which Kurt touched on as well, account for some uncertainty about what might happen to the risk pool given the lack of certainty around enforcement of the individual mandate, perception of enforcement of the individual mandate, and how that might impact who enrolls in coverage and the cost seen in the individual market. We also spent a lot of time thinking about how we would account for the lack of CSR funding and rates, and really believe that the way that we did it, and it's the way that many states did it, would mitigate any negative impact on consumers as much as was possible given the circumstance. And in particular, we instructed all of our insurers to load that cost onto only the price of on-exchange silver plan, which is resulting in significant increases in the subsidy available to eligible individuals and really increasing their purchasing power, particularly relative to other metal levels of coverage on the exchange, and seeing gold plans that might be similarly priced to silver plans and bronze plans that for some may be available at $0 premium. I think the second piece of what we did is really, when I think about this market, we've talked a lot about the subsidy structure, in this market already on the webinar, but the population I worry about are those who do not receive subsidies and those who will face the full cost of coverage through the monthly premium, which in Pennsylvania, I think this is pretty close nationally, is about 1 in 5 or 20% of marketplace enrollees. We worked with all of our insurers to make sure that there was an off-exchange only version of silver plans that would not have the disproportionate increase resulting from the CSR, to ensure that there was perhaps a more viable option for that population. So all of that work that we put into providing at least the best options that we could for our residents created a lot of opportunity, but it also created a really big challenge in terms of making sure consumers understand what is happening in the market, understand their options, come in and shop for coverage and explore, and that's really been our focus since open enrollment began on November. Combined with the lack, and this was also referred to, of federal resources being dedicated to outreach and enrollment activities, the cut in advertising, the cut in the Navigator funds, certainly the shorter open enrollment period altogether is contributing. And so we have responded by running our own outreach campaign, and certainly the resources of the Pennsylvania Insurance Department are not comparable to those of the federal government, but we do have paid advertising on TV, radio, social media, some in Spanish here in Pennsylvania. Working strategically with partners, insurance companies, healthcare providers, consumer advocacy organizations, elected officials to get the word out. And we have also made our own plan compare tool available, partnering with Consumers Checkbook, which has been really critical for that unsubsidized population, to give them a place where they can really comprehensively compare all of the options available to them, including those off-exchange only plans that can't be found on healthcare.gov. So these are a number of the ways that states have already been, and Pennsylvania certainly has already been trying to counter the uncertainty and try to make, ultimately my goal is to try to make the state a source of stability, a source of regulatory stability. We don't want to have any surprises at the state level, because we're really having enough surprises at the federal level to go around. So in terms of how we are thinking about, or have thought about, some of the proposals we've seen in Washington from a state perspective, some of the most critical pieces are operational. Will we have enough time? Will we have adequate and sustainable federal funding for programs? Will we have effective and efficient implementation pathways? And then states really differ in their perspective on this, but I am a firm believer in having a federal backstop for consistency and having a backup plan in certain situations, as we've seen with ACA implementation, where there is federal fallback. In many cases, states aren't always able to take steps forward, and having that backstop, I personally think, is critical. We also, this really gets to the core of the question, what does state flexibility really mean, or at least what should it mean? I think the fear states have had looking at some of the federal proposals, particularly if you look at the funding structures, is that it wouldn't give us the flexibility to do a better job of providing coverage, which is what states want, but depending on the structure of the funding, it would really just give us the flexibility to figure out how to do less and mitigate negative impact of that. And so that gets into trade-offs of who you can cover, what you can cover, how much you can cover, and some of those critical questions that quite frankly, a lot of states are not excited about having to make those tough decisions. In terms of some of the specific proposals we've seen and thinking about the framework that I just talked about, I have a slide here that you can see that has Graham Cassidy and also Alexander Murray, which are two very different proposals. Red certainly indicates areas where at least our state is very concerned. Green indicates things that we're certainly supportive of in the Alexander Murray proposal, and we've been proud in Pennsylvania. Governor Wolf, our governor, has worked very closely with a group of bipartisan governors to try and identify common sense bipartisan solutions that are in many ways incredibly aligned with the Alexander Murray proposal. And in black are sort of areas where it may depend on how it's done. And I'll note that the only reason that the state lines here is black, because that is something that I certainly have concerns about, is that in the Alexander Murray context, it assumes the construct we have today where it is at a state's deference to enter into a compact with another state if they want cross-state sales and work through the consumer protection issues, the regulatory issues at the state level. And I think if a state wants to pursue that of their own accord, that's great. It's when the federal government sort of says you have to do it whether you like it or not where I begin to get concerned. So that's why that one's black and not green. I think also if you go back to those operational issues I was talking about with time and funding and implementation pathways, Graham Cassidy certainly had a lot of concerns about funding, perhaps strongly in the Medicaid space as well as the individual market space, and how those two might play together or play against each other under the funding structure that was really very flexible, as well as the timeline that would have given states just 2 years to figure out how they want to redesign their system and implement a new system. So those are certainly concerns at the state level that we had. Moving on from the congressional proposals, and obviously there have been more than the two mentioned, but I think those provide a good example of the spectrum that we've seen in the proposals. There have been a number of executive actions, and I'm not going to talk about them long because I think others have covered them, but the non-payment of CSRs and the impact of that. We also have very significant concerns about the executive order and the impact that the uptake of non-ACA compliant plans could have on the overall risk pool and the options available to consumers, certainly a concern at the state level. I will note the 2019 Notice of Benefit and Payment Parameters also, it had some interesting stuff in it and perhaps really some flexibility that states were hoping to see. There are some states who are probably going to look very closely at the essential health benefits flexibility. I think the flexibility with the SHOP program is likely appreciated by all. So actually not a lot of concerns here with what was in that notice. In terms of our states or Commonwealth priorities for stabilization, we have certainly been an advocate for the certainty around CSR payments. I would certainly add that we have to think a lot about if something were to happen in the midst of 2018 and how we would deal with that. Robust enforcement of the individual mandate or other incentives that will get people to purchase coverage and bring more people and not less into the market. Long-term federal reinsurance program or state stability funding, streamlining 1332 waiver processes, and I think this one has really become even more important in the last year as we've seen perhaps approvals or disapprovals of waivers at the federal level that it's not always clear precisely what the criteria are for a waiver that is acceptable to the current administration versus a waiver that is not acceptable. And states are going to be looking for clarity, looking for ways to standardize waivers and make sure that if we're going to invest a lot of time thinking about ways to address these issues at the state level, that we're going to get the support and the partnership from the federal government that we need to drive those changes forward. So flexibility to make targeted changes to stabilize the market, perhaps looking at ways the application process can be more efficient, all really good things and important things from the state level. I'll just add that overall, I think states feel like we need to stabilize the regulatory environment at the federal level so that we can stabilize the regulatory environment at the state level relative to that. And certainly we'd like to shift the focus to how we can comprehensively address healthcare costs and try to get more quality into the system and that broader conversation. Here in Pennsylvania is a couple of examples of that. We're having conversations about transparency into costs, both in all-payer claims database on the insurance claim side, also conversations about transparency into pharmaceutical pricing, which I know we've seen California and Vermont take recent steps towards. And we're also trying to really focus on pocketbook issues that are hitting our consumers really hard. The surprise billing and invisible provider issue is one that a number of states have taken action on and that we're currently working on in Pennsylvania and hoping we currently have bipartisan support for that and are hoping to drive that forward because that is an issue where consumers really are doing the right thing and getting harmed by it. And for those not familiar with the issue, I assume many are, this is where a consumer seeks care at an in-network facility or with an in-network provider and sort of not knowing receives some care from an out-of-network provider and is charged with either the full cost or a significant cost for those services. So I'm a firm believer that in these cases where consumers do the right thing, they deserve to be protected, and also really a firm believer that these are the types of issues that we should be dealing with, should be trying to fix, and hoping that we can get some broader stability in the market so that we can have these conversations moving forward. So with that, that is the end of my presentation, and thank you everyone for listening.